So now let's talk about genetic diseases. There are certain conditions that are linked to gender, meaning they are directly related to whether a person has an XX or an XY chromosome pair. Haemophilia, for instance, is far more common in biological males because it is linked to the X chromosome. Color blindness and some muscular dystrophies are also examples of conditions that are more likely to affect one biological sex over the other. If we ignore biological sex when assessing a patient, we might miss these risks or fail to screen appropriately for certain conditions. But how do we do this while still showing respect for the person in front of us? It comes down to separating identity from genetics in a way that honors both. We can acknowledge that someone identifies as male or female or non-binary or whatever we have of sexes nowadays, while explaining that their genetics influence certain aspects of their health. It's a delicate balance, but it's one that allows us to provide the highest level of care without compromising our respect for the identity of the patient. Because the reality is, healthcare requires us to walk this line, if not every day, then close to. While gender is a social and personal construct that has evolved over time, biology remains a constant. Chromosomes don't change based on how we identify, and neither do physiological processes. But this doesn't mean we can't be sensitive to the emotional and physical aspects of gender identity. In fact, it is crucial that we are sensitive to how someone identifies. One of the most important things we can do is foster an environment where patients feel seen and respected for who they are. That means using the right pronouns, addressing them by their chosen name, and by recognizing that their identity is an integral part of their well-being. But at the same time, it means being honest. Not just about, oh, you are having this disease, but about the role genetics plays in their health. This isn't about choosing one over the other,